I'm Dr. Kyle Zanoccoa from the David Geffen School of Medicine at UCLA, here to tell you about our study, Drivers of Variation in Opioid Prescribing Following Common Surgical Procedures in a Large Multi-Hospital Healthcare System. As surgeons, we know that overprescribing opioids can put patients at risk for addiction, and that the opioids we prescribe for pain relief can end up in the community. It's critical to curb overprescribing that could unwittingly contribute to the opioid epidemic. To see what factors might be contributing to overprescribing, we looked at 6 common procedures and identified possible contributors at the patient, prescriber, and hospital level that might be driving prescribing behavior above clinical guidelines. We examined more than 25,000 prescriptions and found considerable variation. More than half of the prescription amounts exceeded recommended guidelines in terms of morphine milligram equivalents. Here, we show caterpillar plots for the 50 highest volume surgeons for each procedure. Each teal box plot represents a different surgeon, and the orange shading marks the clinical guidelines. These plots show that individual surgeons are prescribing significantly different amounts for different patients. The plots also show there's significant variation between surgeons. In the knee scope plot, for instance, we see that the surgeons on the left consistently prescribe much less than the surgeons on the right. We then took a closer look at the potential factors behind the larger prescription size to tease out whether there's a medical reason for them or not. And we found that even after controlling for factors that our team's surgeons considered medically relevant, about half of the factors associated with larger prescriptions had to do with the prescribers and half with patient characteristics. Only a small portion of them were related to the hospitals themselves. We found that several factors that should have been medically irrelevant were associated with larger prescriptions. The prescriber being a surgeon rather than a hospitalist, the timing of the discharge occurring late in the day, and the patient being non-Hispanic Black, a Medicare beneficiary, or having a history of smoking. These findings tell us that this post-op overprescribing is most likely related to prescribers' training or their lack of awareness of current guidelines. Some prescribers could also be erring on the side of larger prescriptions so their patients don't get stranded without enough pain relief. Efforts to educate prescribers on current guidelines could help reduce overprescribing behaviors. I'd like to thank all my co-authors.